Hello everyone, Dr. David Cullah here. Today we're going to talk about microdiscectomies. So a microdiscectomy is a type of back surgery. There are several types of back surgeries. Just to name a few, there's a hemilaminectomy where they actually cut the lamina off, as you can see right here in the back of the bone. That creates a lot of instability, and we've done videos on hemilaminectomies. We have several patients with hemilaminectomies, and we approach it very similar to a microdiscectomy. A microdiscectomy is probably the least invasive of all of the different types of back surgeries. Now, injections, cortisone injections, are considered back surgery in the medical world, so we're gonna leave those out. We're gonna leave out cortisone injections, epidurals, and kind of put those to the side. Those are not really surgical to me, but in the medical community, they are still considered surgical because it's a needle that goes inside the body. But aside from those, we have hemilaminectomies. You can get a double laminectomy on both sides, which creates just severe instability. Most of those people do not do well. And most people with hemilaminectomies, where they have one side of the lamina cut off, don't do well either. I found that people with microdiscectomies do the best. Microdiscectomy is the least invasive of the surgeries. And then you have a disc replacement, right? So you have a fusion where they fuse the two bones together without the disc, or you have some surgeons that will put a fake or a titanium disc in there. And from my experience, you could ask a surgeon, but when you have a titanium disc, you can only have one replaced. In other words, you can't have multiple discs in a row replaced. You might be able to have another titanium disc put up in another area of the spine, but that's from my experience talking to surgeons. Of course, you should consult with your surgeon if you're considering surgery. But if you are considering surgery, you should definitely consider these two therapies. What we're doing here for her is cold laser therapy. What cold laser therapy is going to do is it's going to reduce the swelling, decrease the pain, reduce the muscle spasms, and also eventually break up scar tissue. Now, we're on our first treatment with her today, so we're not expecting to break up scar tissue on the first treatment. We're just focusing on pain, reducing the swelling, and muscle spasms on our first treatment. But after a couple of treatments, then we start to focus on how we're gonna break up scar tissue. And we just do that by changing the frequency that we use with this laser. And a lot of people ask me questions about lasers and lasers on Amazon, and can I get an affordable laser? I've done videos on that. Please make sure you check those out. But lasers are not all created equal. You have lasers, you have red light therapy, and then you have infrared, okay? And most good lasers have all the above. The laser diode with the infrared with the red light therapy, okay? And the red light and infrared really are only effective on the surface, so on the skin area, maybe for a scar on the skin. And these lasers can reduce the appearance of a scar, but there are better lasers for that are more effective, that work quicker, like Fraxel lasers, things like that at dermatologist's office. This is a non-ablative lasers. The lasers I use, the cold lasers, are non-ablative. They don't heat the tissue. So a lot of doctors are using hot lasers. I'm not sure why they would do that, because a hot laser heats the tissue. The whole purpose of lasers is so you don't heat the tissue, so you don't have that thermal effect. So now that we've done laser, we're gonna go into the Cox technique, and I'll show you a little bit how we do that. You guys have definitely seen me do videos on the Cox technique, but I wanna get into a microdiscectomy a little bit as I start to take care of Isabel here. And with a microdiscectomy, basically what they're doing is they're taking a look at your spine and they're seeing that a little piece or sliver of the disc is sticking out and pressing on the nerve, or maybe it's pressing on the spinal canal. And that little sliver of disc sticking out from the space where it should be in between the two vertebrae then gets sliced off. Just a little sliver of it is sliced off, and then they sew you back up. So yes, you're losing a little piece of your disc, and yes, it makes you a little more susceptible to herniating that disc worse later. So you have to be careful. So she was saying that her surgeon told her after the surgery that she can't run more than 5 miles, and I guess she wasn't expecting that, right?
Yeah.
You're a big runner then, I assume.
No, but I like to work out, and that's not
Okay.
like high distance.
So, well, the beauty of it is when we run, we get that runner's high at about, or at least I do, at about the second mile, and that's less than 5 miles.
Yeah.
So you could run and do 2.5 miles, get that runner's high, and just don't overdo it, okay? But really, running is a lot of pounding on the body. And the best thing for somebody that's had back surgery, hands down, would be swimming. Low weight, non-weight bearing. It's just a great exercise. It works every muscle in the body, including your cardiovascular, your heart muscle. So it's really a great exercise tool for those suffering with back injuries. It doesn't have to be a disc injury, but again, swimming is the best thing. If you know how to swim and you have a pool and you have access to a pool, I highly recommend that. Even using a kickboard could be fine. So what I'm doing here is, yes, I use the laser to reduce the inflammation, but I'm also loosening up the quadratus lumborum muscle and the erector spinae muscles here. And I'm getting in here with a little bit of elbow grease. She's had 1 visit already. And the Cox technique, the first visit, can leave you feeling like your back is a little weak after that first visit. That's really normal to have that feeling for a couple hours or for the rest of that night. But the next day, that should really ease up. And she definitely had that. She had a little bit of weakness in the back. So I explained to her today on the second visit, you won't have that feeling. She's not gonna feel that weakness in the back as much. Tender right there?
Yeah.
So her quadratus lumborum, we call it the QL muscle. It's a little tight here and a little sore. It's probably not as sore now because I lasered over it. What I should have done, and I've done videos on this before where we touch a point on a patient, have them give us a rating of how sensitive it is, 1 to 5. You know, and we've shown you, we've had people with like a 4 or a 5 and pain levels on a certain trigger point or muscle area. And then after we laser it, it goes down to a 2 or a 1. If you haven't seen that video, check that out. That's a video we did on cold laser and trigger points.
Tell me on a scale of 1 to 5 how painful it is when I press. 5 is going to be the most pain, 1 is going to be the least pain. Is that sensitive there?
Yeah.
What's that? That's a 5, okay.
Yeah.
60 seconds. Now we're going to test it. How does that feel? You're not jumping.
No pain.
No pain at all. Laser light, that's it. Game changer.
It could be very effective for so many things other than just disc injuries or post-surgical or pre-surgical patients. Okay, so we loosened up the right side. We're going to loosen up the left side before we go ahead right into the flexion distraction technique. And luckily she doesn't have any pain into the legs. And you had the MicroDiscectomy done how many years ago? 2020. So, you know, we're at the beginning of 2024. She was doing well from the surgery until sometime during COVID, or was it just recently?
Like a month ago.
A month ago, okay. So her surgery, you know, for the most part went well for the first few years. Some people with microdiscectomies do really well, but regardless, you're dealing with less of the disc than what you had before. So you have to understand that, be careful, build your core. And again, swimming is one way to do it. Pilates is another way. I do not recommend yoga for people with microdiscectomy because yoga requires you to bend and twist and mix motions together that should not be mixed. And it's gonna put you in a precarious situation where you may end up having another surgery, God forbid. So yoga could be a little risky, let's put it that way. Do you do yoga?
A little bit.
A little bit? What about Pilates?
Yeah.
Okay.
Once a week.
Okay. So the issue I have with yoga is when you bend down and then twist at the same time, or extend back and twist at the same time, you're putting your discs, you're putting a lot of pressure on your discs and putting your back under a lot more stress, and it's risky. It's not just that. We have flexion extension, we have lateral bending and rotation. And when you mix any 2 or 3 of those motions together, that's when you're asking for trouble. So Yoga is notorious for doing that, mixing 2-3 motions together. I think this is called the warrior pose, where you kind of do this, right? You touch the toe, right? And what that is flexion and twisting. No good, it's dangerous. So that's why I'm not a big fan of yoga for your situation, okay? So we just did a gentle adjustment there. And now we're gonna go ahead into the flexion distraction technique. So we're gonna strap your legs in here. We're gonna move the camera over here so you guys can see a little better. Hand placement is important. You don't wanna place the hand below where she had the surgery or below the disc herniation, unless you just don't want the patient to get up off the table or you want them to curse you out. So we're starting up higher. And this is one way you know that the doctor is certified in the technique. He should be starting up higher, not all the way down here in the beginning, okay? And when I say higher, I say somewhere in the mid-back region. And because she had a little bit of weakness in her back after the last visit, or her first visit, her first adjustment, we're gonna go easy today. This is protocol 1 of Cox Flexion distraction technique. And it's this very, very gentle pumping motion. This pumping motion allows fluid and nutrients to get into the back of the disc. It also opens up the back of the disc space, taking pressure off the nerves and the spinal cord. So if somebody has spinal stenosis, this will help as well. This is an osteopathic / chiropractic technique. Dr. Cox's father was an osteopath. Dr. Cox is a chiropractor in his mid-80s now, and all the research is out of Indiana University. There's a ton of research on this technique, and it's extremely effective. If you're considering surgery, try this first. Thanks for tuning in. I hope you guys learned something, and if you have any questions or comments, feel free to comment below. Thanks, Isabel.
Yeah, no problem.
Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.